My presentation will be about therapies in Mediterranean countries. It is not going to be like the previous speaker's speeches because I'm not very equipped with my topic. It's going to be a humble review altogether. As you all know, very frequently alternative therapy terminology is used, but in the very beginning I would like to state that I am against this treatment type. It can be only a supportive treatment because there is no alternative therapy for diseases which require very important drug treatment. There are certain nutritional or herbal based products and they can create effects on our brain pathology. If we know those effects, of course, it can create additional benefits to our treatment. From time to time, we can come across with certain information like this. For instance, a herb like curcumin might have great impact over our health, and our daily diet could also be combined with the treatment. It might give great results at the end. So a lot of things have been written and said, and I will be talking about St. John's wort today. This is the main topic of my speech. So there are different herbs and also nutritional habits. So we know that it is a big discussion that everything is debated right now, whether they are effective or not. Sometimes we are discussing the magnesium effects on the brain health, or else its effects on the psychology, and some products can also be used by collecting more proofs. Of course, here against drugs, against chemicals, there is a certain perspective because we cannot get everything that we expect from drugs, and we might turn our faces towards nature or the natural products that are the blessings of the God to us. So let's have a look at the process. What happened during this time? It actually dates back to 2000 BC. It was a treatment approach by eating a certain plant. Of course, throughout this period, different religion systems, belief systems occurred, and we have seen some changes. But as of the year 2000, by eating certain plants, treatment options for certain diseases are again discussed, and it is on the agenda of many physicians. So right now there is agents. I'm not going to be saying them herbs, but they are active agents. In the world there are approximately 70,000 plants, and in Turkey it is 10,000. So when they are used for the treatment of the cases, up to 80% there comes the success. But we need to know the new treatment strategies when we accumulate some knowledge on these approaches, or else traditional treatments. Can we really harmonize them with the current medical approaches? And beyond everything, do we really have evidence for those herbal remedies? Because these are the main components for our discussion. At this very point, if the producer company is commercially available on the market, we need to know the producer company, and also the extracts must be known whether it is standard or not, because there are a lot of different mixtures. They can be available in the market, and as I've stated beforehand, we need to know to what extent we have clinical evidence. We need to know whether they are trustworthy or not. So reliability and validity indexes must be used, because you might be missing the points, or else you might really hit the target. We might come across with very undesired situations because of the situation of the patient. So who is administered herbal drugs, what is the age of the patient, and what are the other additional components used along with the herbs. We have to be taking those things into consideration. St. John's wort, this has been asked by me. I will be talking about this, but lavender is very much important for Mediterranean culture. The essential oil extracted from the fresh flowers, it has linalool oil and linalool acetate, and it has also umbelliferone It can also eliminate the migraine prophylaxis. It prevents loss of appetite. It might be very effective on the anxiety. Another herb is Passiflora incarnata. Passiflora is mainly used by a certain age group as syrup or in a tablet form. It includes flavonoids at a plenty amount, and it has also gynocardine substance inside. That's why it is accepted as effective in anxiety disorders and insomnia disorders. And saffron, Crocus sativus, this is also available in our country. It is comprised of crocins and quercetin. It has volatile oil, and picrosin is very much important. When saffronal is used from 2 to 4 grams per day, it has anti-convulsant and anti-anxiety effects. Another herb is valerian, Valeriana officinalis. It has different forms. In Turkish, it is the herb of a cat. Generally, the dried roots of this plant are used. It has a lot of alkaloids inside, especially valerian, and there are volatile oils again. So insomnia, depression, sedative, anxiolytic, spasmolytic, and muscle relaxing vices. It is a very effective drug. But there are a lot of literature items about valerian. It increases the GABA release. It inhibits GABA uptake, and the main performance of valerian is performed in this way actually. A daily dosage, by the way, I'm not an expert on this topic, but daily dosage might change from 100 to 3,800 milligrams. Another herb is lemon balm, Melissa officinalis. It has the oil, dried leaves, and the fresh leaves and whole plants, according to the usage. The parts of the plant might change. It includes volatile oil, and it is mainly used in anxiety and insomnia, between 1.5 to 4.5 grams. When we say Mediterranean region, lycopene can come to our minds. Maybe it is not at the same group with the other substances, but it has great antioxidant effects, and it is very much appreciated in our daily nutrition, and it is very much effective on the CRP and serum cholesterol levels. It might decrease the elevated CRP levels, and it also increases acetylcholinesterase activity. It might be preventive and protective for Alzheimer. This is discussed, and it can create certain changes on the hippocampus. So it might actually permanently correct all these problems in the hippocampus, and primarily strawberry, but also other members of the berry family, raspberry, blueberry, all other berries. These are also very important because they have a catechin, quercetin, and caffeic acid derivatives to a very great amount. Thanks to these features, they can consolidate memory, and they are also very much effective in the motor cortex disorders. They are mainly affected by the neuroplasticity and neurotransmission. At the very end, neuronal cells might survive better.
Now, as for the St. John's wort, which is good for all the problems, it's the miracle herb of Mediterranean region. It includes anthracene derivatives like hypericin, pseudohypericin, hyperofin, phyllonopropanes, and the content is quite rich, and the mechanism of action is serotonin, dopamine uptake inhibition, and they're more or less the equal amount of inhibition, and GABA receptor binding. It increases GABAergic effect, and MAO inhibition, very weak, but hypericin has an effect on that. Protein kinase C inhibition, and out of cytokines, it suppresses interleukin 6. It has a selective effect, and NMDA receptor antagonism is being seen as effects of St. John's wort. It's quite diverse, the mechanism of action of St. wort. And serotonin, it has an effect on serotonergic system, and it downregulates the cortical beta adrenoceptors and 5-HT2 mechanisms. SSRIs, tricyclic antidepressants, and monoamphinaze OIs are being compared, and in terms of adverse effects, it is quite innocent. Because of this reason, St. John's wort is preferable. I will be talking about a couple of studies. Sertraline, for example, there is no superiority of St. John's wort. Paroxetine and paroxetine, at least as effective as paroxetine in major depression, and it is controlled. It's the result of controlled studies. And stelopram controlled studies. And stelopram's effect is equal to St. John's wort and their antidepressant effects. And in terms of dosage, it depends on the hypericin content, and the main criteria is the amount of hypericin. It looks like that there is a consensus about that. Usually 0.3% hypericin is being recommended, and it is the dosage of 300 milligram in an oral preparation, and it can be used 3 times a day in a safe manner, and it takes about 6 weeks to notice a difference, and that is the upper limit. It's not recommended to use it more than 6 weeks. As I stated earlier, in terms of side effects, when it's compared with the other antidepressant drugs, it is advantageous, and sensitiveness to the light is one of the most important adverse effects of St. John's wort, and the other side effects are reversible side effects, therefore it is advantageous. And among the side effects, gastrointestinal problems are the major ones, and if it is being used with the food, these adverse effects are bearable. And St. John's wort drug interactions are of great importance because it has a wide effect spectrum. If the patient is using other antidepressant or immunosuppressive drugs, and also protease inhibitors used in HIV treatment, there are serious interactions. Therefore, you need to be very careful while using St. John's wort, because hyperforin is the effective matter in the St. John's wort, and it has an inductive effect in some enzyme mechanisms. Therefore, you need to be very careful while using St. John's wort if the patient is using other drugs. And monoammoxidase inhibitors, when they are being used, there might be serious changes in the blood pressure, and if it is being used with SSRIs, it might result in a serotonin syndrome. Loperamide, for example, antidiuretic, if it is being used, delirium can be resulted. When it's being used with oral contraceptives, it can cause bleeding. And theophylline dioxin, its therapeutic index is quite narrow, so you need to be precautious while using it with St. John's wort, and it might be decreasing the effectiveness of oral contraceptives. Therefore, it's one of the major risk factors. and it should not be used during pregnancy or while breastfeeding, because there is no safe information. There is no safety information about the use of St. John's wort. And sexual dysfunction has never been reported, whereas it's a common problem with other antidepressants. And we can say that there is not enough clinical proof of that. And other things to keep in mind: only in moderate and mild depression it's found effective. In the serious depression cases, it's not being recommended, and in bipolar, it's not recommended. Simvastatin and pravastatin and their interaction, there are some studies conducted in that regard. Therefore, in pravastatin, there is no change, and it is decreasing effectiveness of alprazolam, especially it is decreasing the half-lifing of this drug. Warfarin is important because St. John's wort increases warfarin clearance, and it decreases anticoagulant effect of warfarin. And digoxin is also being affected, especially if it is rich in hyperforin. It's quite dependent on the concentration of hyperforin of St. John's wort. When we look at the rest of the world, we can say that it's not approved by the FDA. Europe is using it a lot. Germany is the leader, and in our country we know that it's approved by the Ministry of Agriculture. The content might vary, therefore only the herbal substances, and we should not say that there is no toxic effect. We should be checking the content of that, and we should be checking under which conditions we can use it, so that we can avoid unwanted situations. To sum up, this has been used for so many years, and these herbal resources, primarily St. John's wort, we need to be careful about their advantages and disadvantages, so that we can make maximum use of them. The concentration of these materials should be checked, and with which pathologies we can co-use, we need to be checking them. Yes, of course, natural resources should be used in a proper manner, because it's going to contribute to our mental health, and we need to be using them in a conscious manner so that we can benefit from them. And thank you very much for your input.